Hi, Leo. Good to see you again.
Hi, good to be back.
Good. So, how's everything going?
Okay, my dad was trying to get me to do some meetings, but I ain't really with the meeting things. I told him meetings remind me of bad, bad stuff. They're all talking about getting high and drinking and what it's doing to them, what it's already done. I don't want to hear that.
Okay. Is that what brings you in today?
Pretty much,
Okay.
just
Now, let me ask you about how you're feeling. How's your mood overall?
about it for
About a four. What can make it a 10?
some money.
Some money.
Yeah.
Anything else as far as like emotions or how you feel though that could make you actually feel better?
Yeah, if I could just live and maintain without uh, using things to help me get through the day, that would be happy then. That would make me happy.
Without using things to get you through the day, such as.
Drinking and drugs,
Okay.
without those to get me through the day, it's kind of rough. But if I could get through the day without those, I'd be happy.
Absolutely. Okay.
So if I could get clean,
Mhm.
I'd be happy.
Okay.
It seems impossible. The meetings they want me to go to, they just talking about getting high. They're
Mhm.
not. No one's telling me how not to get high. They're telling me about when they were getting high, and what they were doing, and who they were doing it with, and how much money they stole to get it. And
Mhm.
no one wants to hear that.
Okay. That's understandable. Now, I do want to explore that with you some more today. But I first want to set the agenda to kind of give you an idea of how things will flow, if that's okay.
Okay.
Okay. Now, while we talk, I will take some notes, if you don't mind. You'll see me look down a couple times, and I'm just taking some notes of some things you might have said. And I
Okay.
also want to encourage you, if you would like to take notes as well, that's okay. If you want to,
Okay.
jot down any notes of anything that we discussed that you want to take home and kind of revisit. Up to you. Okay.
All right.
Okay. Um, so today I want to teach you about a skill called ACT, which is a form of cognitive behavior therapy, and it stands for acceptance and commitment therapy. And it's pretty self-explanatory when you hear acceptance and commitment, right? So just accepting some of the things that you might think about or go through,
Okay.
um, and making a commitment to change. Um,
Like accepting that I'm an addict. So I have to accept that.
yeah,
Okay.
you can accept that, and then you can also make changes
Okay.
towards that and becoming the person that you really are.
No, I asked that because I heard that before. Uh, my father said it to me that I would have to accept the fact that I can't live without drugs. I had to accept that I'm an addict. I don't
Mm.
know if I'm ready to do that. I don't know if I want to label myself
Right, and you
addict.
don't have to label yourself as an addict, but you can accept the behavior for what it is, but you can also modify it. So you can say, hey, this is something I struggle with, but this is what I plan to do to get out of it. Or
Okay.
this is the behavior I choose to put in place of this instead. Okay.
I like to get to that place.
Okay. Well, I'm here to help you try to get there. Okay. So I want us to, get into that along with, I'll have you provide an update. We can review some homework and then focus on what brought you in today, which is what you've already shared. Okay.
Okay.
Um, So it sounds like you had a recent conversation with your dad. So you pretty much kind of given me an update, but how did that um, how did that conversation make you feel overall? Like I hear you saying you don't want to accept the term addict. What else do you feel about what was said from him?
I feel like he's desperate. And he makes me feel like I really need to go to these meetings because he sounds so desperate about it. But my feelings about those meetings are, like I said before, that people just talk about the bad things. No one's talking about they got 2 years clean now. They got the job back. They got the wife back. No one's talking about that. They're just talking about the down times and how bad it's been.
So you feel like the meetings that you're going to that are supposed to help you get through your substance abuse is actually doing the opposite. It's
Depressing me, yeah. You got it.
okay. Now, for the homework, I know we discussed that you were to go to an NA meeting and go to these groups. And it sounds like you have gone, but have you gone since the last time you went and you heard these stories about people not really being serious about their recovery and things? Have you been again since that time?
No, I haven't been.
Okay. Do you plan on returning at all, ever?
Well, it depends. I mean, if you could give me a good reason why I should go around and listen to people cry about their history with drugs and alcohol, then maybe I'll go back.
Okay. Well, I'm glad you said that because that's kind of leading me to my next question, which is what are the actual pros to going to these groups? I know and I understand your frustration with what you're hearing, the things that's going on with the people that are there, right?
Yeah.
But what are the actual good things that you've taken away from groups so far?
Oh, well, I guess the good thing is that there's the idea that there's a place for me to go to when I reach my bottom. Just the idea of it being some help and there's an actual facility that I can go to. Just that idea alone is comforting. Knowing there's some place I can go to and talk about whatever I'm going through.
Okay, good. That's good. Can you think of any other pros or good things?
Get me out the rain. Let's see. I get to meet new people.
Okay. So there are some people that are positive that are there. There are some people that
there are some quiet people at the meeting. No. No, there are some positive people there, like the people that run the meeting. They
Okay.
seem to be positive.
Okay.
And yeah.
Okay, so we have it's a place to go where you can kind of get out of
The rain.
well, out of the rain. That's one. And maybe thoughts of wanting to use and stuff. It's a place where you can go and kind of just regroup and
Yeah. Yeah. I usually use the meetings just to like you said, regroup, just to get a break. the streets.
Okay. So it sounds like there are some good things about the group. Do you feel like the pros outweigh the cons of actually going back to the group? Now that we kind of went over a few.
I wouldn't say that. I still think that most of the people in there are depressing, and they bring my spirit down.
Mhm.
So,
Okay.
although it's a place I could go to if I just want a break, and the idea that there's a place for me if I really, really want to do this. Those are two good things, but I think the one thing that outweighs it is those people talking about those depressing stories. I
Okay.
don't want to hear it.
Okay. And does that usually happen like in a group setting? Or is that like usually when you guys are outside congregating afterwards or before? Or is that happening actually in the meeting?
That's in the meeting.
Okay.
When people are talking about their lives and what led them to drugs and
Mhm.
what the drugs have done to them.
Mhm.
And I get tired of hearing that.
Okay. Well, I do want to tell you that, if it's causing you to become depressed, I would encourage you to maybe try other groups. I mean, there's many other options that you can possibly go to and see how you feel about those environments, those people, and see if you fit in better there.
Well, okay.
How does that sound?
That sounds good. Maybe there are some just men meetings, maybe.
Okay. Well, maybe I can assist you with finding one of those
Okay.
that's nearby your house, so it can be convenient for you to get there.
All men's meeting.
Okay. So sometimes it's the women that kind of maybe take over the group with some depressing stories of their past and things like that.
Yeah, there's a lady talking about she's on the rooftop in New York having a baby, and she's got a pipe right there. She's got the rocks right there, and she's going through. She's having the baby, you know, and she says she's having the baby, and her friends tell her to push, but she's looking at that pipe, and she picks the pipe up right while she's in the middle of pushing. You know, who wants to hear that? Then she talks about maybe throwing the baby off the roof after she gets high. The baby's crying and crying, and she's a mess. Terrible stories.
Okay. Yeah, I could see how that might cause you to feel depressed or discouraged, So
Yeah.
maybe we can find you another group to get you in a different atmosphere and see how that goes. Okay?
An all men's group, maybe.
Okay. All right. Well, I definitely made note of that, and I will look into that and get you a list of names before you leave today. Okay. Now, to get into the ACT, the acceptance and commitment therapy, so pretty much it's focused on clarifying your values and your goals and becoming more willing to change without necessarily changing your thoughts. But actually accepting them for what they are, if that makes sense.
Oh, accepting my thoughts and not changing them.
Right, accepting your actual thoughts that you have for what they are, instead of attempting to change them or change. It's better for you to change your behavior, because maybe your thoughts are gonna, your negative thoughts sometimes are still going to be there.
Okay.
But you can work against them by taking action towards changing this, changing that, and then over time. You can get a lot better, if that makes sense.
Yeah, that makes sense.
Okay, so that's the premise of that. And the 3 steps are accepting thoughts and feelings. And then it's choosing a direction to go in, and then taking action. So you're already taking action by attending groups. That's first. You're
Right.
having some trouble with it,
Right.
but we're going to work around that and get you into a group where you feel more comfortable.
Right. Sounds like I'm on point. Sounds like I'm on the right track.
Because the first step is acceptance,
Right.
which I believe you've done. I don't know if you feel the same, but accepting the fact that you need treatment, right?
Yes.
And you've taken the step towards modifying that behavior.
Well, I will accept that I need treatment, but I won't accept being an addict.
Understandable.
And I will change my behavior towards meetings if I could get into a meeting, maybe with just me.
Okay. I think that's a good plan.
So am I on the right path?
Absolutely. So what I'll do is I'll find a group for you to get into, and then I want to assign that the homework be the same, that you attend a group. So I know you haven't gone since the last one, but with the new list that I'll give you today, I do want to assign that as the same homework assignment for next week. So when I meet with you again, I will hope to hear that you've attended another group, and see how it went.
Okay.
Okay?
All right, sure.
Sounds good?
Sounds good. Sounds like a plan.
All right. Now, do you have any questions or comments? Anything else that you wanted to touch on today, or any concerns?
No, can't think of any.
Okay. All right. Well, I want to thank you for coming in today, and sharing. Just to kind of just do a quick overview, we kind of went over your mood, which you said was a 4, and you said to make that a 10 would be to cease from drinking and using drugs and things like that.
Right.
You did give me an update of what you talked about with your dad. We went over that. We talked about your homework, how you didn't do it last week, but moving forward, you plan to try a new group.
Right.
Okay. And we went over acceptance and commitment therapy, kind of gave you a little education about that, and working towards change.
Right.
Okay.
ACT. A-C-T.
Mm-hmm.
Right, got it.
All right. Well, here is the list of
Thank you.
groups to go to. And let me know how it goes, and we'll go from there.
Okay, thanks.
All right. You're welcome. Bye-bye.